All right, let's dive into one of the most incredible structures in the entire natural world, your very own spine. I mean, it's an absolute masterpiece of engineering. It holds you up, lets you move, and it protects the most critical communication highway in your entire body. So, how does this amazing thing actually work? Well, first, let me ask you a question. We always hear people say stand up straight, right? But have you ever stopped to think about the fact that the human spine is anything but a straight rod? And believe me, there's a brilliant reason for that. The secret is all in its signature S shape. The shape isn't some kind of defect. It's made up of four distinct curves that are absolutely essential design features. You can think of it like a natural spring that helps us balance, absorb all kinds of shock, and, of course, stand upright against the constant pull of gravity. Now, these curves alternate between two types: lordotic, which curve inward toward the front of your body, and kyphotic, which curve outward. So if we start at the top, the cervical spine, that's in your neck, has an inward lordotic curve. Then the thoracic spine in your upper back curves outward, that's a kyphotic curve. Below that, the lumbar spine in your lower back curves inward again. And finally, the sacrum curves back out. It's this alternating pattern that gives the spine such incredible strength and flexibility. So you might be thinking, okay, were we just born with this perfect S shape? And the answer, which is pretty fascinating, is actually no. This is a structure that adapts and literally builds itself as we grow. See, when we're born, our spines just have one long C-shaped curve. We call these the primary curves, the thoracic and the sacral regions. The other two, the cervical and the lumbar curves, are called secondary curves. And they get that name because they form later in response to, well, learning how to live in the world. The secondary curve in the neck, the cervical one, develops around 8 to 9 months old. And think about what's happening then. That's right when a baby is gaining the strength to lift its own head. Then, a little later, between 12 and 18 months, that lumbar curve forms as a toddler learns to stand up and walk. Our spine literally reshapes itself to help us move. How cool is that? Okay, so let's zoom in from that big picture and look at what sits between our vertebrae. We have these incredible little shock absorbers, and honestly, the best way to picture them is to think of a jelly donut. Seriously. The jelly filling in our donut is called the nucleus pulposus. It's this gelatinous-like core that is just fantastic at absorbing impact and pressure from every step, jump, or run you take. This is your spine's built-in cushion. And what keeps all that jelly from oozing out? Well, that's the dough of the donut. It's called the annulus fibrosus. It's this super tough, fibrous ring of cartilage that wraps around the nucleus, giving the whole disc its strength and keeping that gelatinous center locked in place. And it just makes perfect sense that the biggest, toughest jelly donut in your entire spine is located right at the very bottom, between that last lumbar vertebra and the sacrum. I mean, that's the spot that has to bear the most weight and stress from your entire upper body. The vertebrae themselves fit together with this incredible precision. You've got these notches in the bones that line up perfectly to create little openings for all the spinal nerves to pass through. And where the vertebrae actually connect, they form these small, movable joints that let us twist and bend. It's this beautiful, intricate, interlocking system. But, like any complex piece of architecture, things can sometimes go wrong. This amazing structure isn't immune to problems, so let's take a look at a few of the more common conditions. Sometimes the spine's natural curves can become really exaggerated. For instance, scoliosis is when you get an abnormal sideways or lateral curve. Then there's excessive kyphosis, which is an extreme outward curve of the upper back, sometimes called a hunchback. And on the flip side, you can have excessive lordosis, which is a really deep inward curve of the lower back. And remember our jelly donut? Well, one of the most common and painful spinal problems happens when it gets damaged. This is a herniated nucleus pulposus, but you've probably heard it called a slipped disc. And it happens most often down in the lumbar region, right where all those forces are greatest. So how does this happen? Well, first, that tough outer wall, the donut part, weakens or tears. Then the jelly-like center pushes or ruptures out, and if it pushes out in just the wrong direction, it can press on or pinch a spinal nerve, which, as you can imagine, causes some serious pain. Okay, for our last condition, I have to share this really fascinating quote you might hear from a radiologist. What on earth could a Scotty dog possibly have to do with the human spine? This is how they diagnose a condition called spondylolisthesis. It's where one vertebra actually slips forward over the one beneath it.
Amazingly, when you look at an X-ray from a specific side angle, parts of the vertebra form a shape that looks just like a little Scotty dog. Radiologists know that if they see what looks like a collar or a break on the dog's neck, it's a telltale sign of a fracture, which confirms the diagnosis. It's a really clever visual tool they use every single day.
So, from its incredible developing curves to its jelly donut shock absorbers, our spine really is a daily miracle of biomechanical engineering. It's constantly working, adapting, and supporting us. And that leaves us with one final and really important question to think about. Knowing just how incredible this structure is, what are we doing to protect it?